with your index finger and thumb, okay, on both sides, and then I want you to just kind of feel down how far it goes. And I want you to do the same at the superior pole. So I want you to find the superior and inferior poles of the patella, and I want you to just kind of try and move it side to side a little bit, see how much mobility there is. Okay? Some people are going to have a lot of mobility, some people are not. You can also, when you're trying to find the poles, if you're pushing on the inferior pole, the superior pole is going to kind of elevate a little bit, and that'll help you find it better. Okay? If they have pain at the inferior pole, what would that indicate? Anybody know? What attaches down here at the inferior pole that goes and attaches here? From here to
the
here.
anterior lateral quadrant.
Good try, but no. From the patella down to the tibial tuberosity, what's this big band of tissue right here?
The tendon.
Okay, the patellar tendon.
Oh.
Okay, so on the inferior pole, when I push on the superior and lift up the inferior pole, if I have pain right here at that tip, that's usually a really good indication of patellar tendonitis. Okay, inflammation within the patella. Have we gotten to that in our notes yet? Okay, so that's something that you'll see in our notes when we talk patellar tendonitis. That's where that pain would be. Now, as we follow the patellar tendon down and we get to the tibial tuberosity, which is this bony bump on the front of your tibia, that's where that patellar tendon inserts. If they have pain there, it could be an indication of Osgood-Schlatters disease or disorder. Okay, it's not really a disease. It's a condition, and again, it's coming up in our notes, but it's a condition where when a person is going through growth phases, if it's an area where there's a epiphyseal plate, and when that person grows too quickly, the patellar tendon will start to separate away from that insertion point, and it'll cause a lot of pain. So if you ever see someone who's got a big bump there, they probably went through that point of pain while they were growing because of, they call it Osgood-Schlatters. Like I said, it's not a disease, it's just a condition. There's nothing that can be done for it other than resting and not irritating it while the person's inflamed. And once they stop growing, it's totally fine. They may have a residual bump, but there's nothing wrong with it, okay, and they don't have pain anymore. So you can palpate the tibial tuberosity, you can palpate all sides of the patella, you can palpate the patellar tendon. You can palpate the head of the fibula, okay? As I go up the bone on the fibula side, so I have muscle here, okay, I get to a little bony part, and you can have them help you, okay? Does that feel like I'm on bone, okay? When I get to a bony projection, some people's, again, it's gonna stick out more than others, but it's gonna feel hard, bony. That's the head of the fibula on the lateral side, okay? If I get just above that, that's the joint line. There's gonna be like the bony part, and then there's kind of a gap. And then if I go above that, I'm going to find the distal end of the femur, okay? So I find distal end of femur, I find head of fibula. Right between there is what structure? What joins the head of the fibula and the distal end of the femur? The lateral condyle. The what?
Patellofibula.
You're in the ankle.
Oh, Achilles.
It's a what? The LCL, okay? The lateral collateral ligament.
Yeah.
Okay, gotta get on the right side of the right body part. So we have the lateral collateral ligament. It's gonna be right there in that little joint space. So you can kind of palpate. And again, depending on, if you got a really skinny, tiny person, you can feel that little fiber band of tissue, okay? If there's more tissue on the person, or if they're a bigger person, you can't really feel it. But if you've got a skinny, tiny person, it's a lot easier. That's why really skinny little people are fun to like look at their muscles and stuff, because you can see everything. It's easier to see. On the medial side, so if we have the lateral collateral out here, what are we going to find on the medial side? Medial collateral. So here, I'm going to find the tibial plateau, so I'm going to find where it's bony on the medial side. I'm going to find the bony part of the medial condyle of the femur, okay? And as I get close, then there should be a line or a gap between the bones. That's where my medial collateral ligament's going to be. Okay, is that right?
That felt weird.
Okay, so my medial collateral is going to be right there. So you can palpate that.